Hello everyone, Leslie Cornwell here, Midwifery Business Consultation. I'm going to do a breastfeeding class. This can be great for consumers, this can be great for birth assistants, and even a refresher course for midwives. So just a little bit of background on myself. I've been a certified nurse midwife since 2012. I've been part of the healthcare industry since 2004. So I've done many different roles. I've been a director of birth centers, ran my own home birth center practice, and so there's a lot of experience going into these presentations. So the objectives of this course: be able to discuss reasons why breastfeeding is so important, be able to discuss national and international recommendations on breastfeeding, be able to discuss the history, benefits of breastfeeding, the local resources to help with breastfeeding, how to find them in your area, discuss stages of breastfeeding and tips for moms the first month of life for the baby. Discuss ways to support breastfeeding through the child's early years, and be able to discuss with the community and the healthcare system how we can better support breastfeeding. Importance of breastfeeding: it literally is, breast milk is liquid gold. It is so valuable to the new moms and babies. It's not just helping the babies stay well and smarter. There's so much evidence that breastfeeding will improve bonding. It will decrease the risk of ovarian breast cancer for the mothers. There's just so much importance to breastfeeding and the breast milk itself. Every infant and child has the right to good nutrition according to the Convention of the Child's Rights. So there's a lot of discussions with formula in the last 100-year history. I strongly encourage anyone to read The Big Letdown. It's a newer book that came out that just really goes into the backdrop history of the American Pediatric Association and Enfamil and formula companies, and the marketing campaigns that have been done the last 100 years to really confuse consumers. What is the difference between breast milk and formula? In my opinion, they can't even be compared in the same category, but our society has been really trained well to compare them to each other. So the breast milk, if you can do it, is by far better for the mom and baby. Globally, in 2016, 155 million children under the age of 5 were estimated to be stunted, too short for their age. 52 million, it's estimated to be wasted, too thin for their height, and 41 million were obese. So there's two paradigms. Some of this has to do with underdeveloped countries and lack of water sources, good nutrition. Heaven forbid something happened to the mom and formula wasn't an option, but also really pointing out the 41 million were obese. There's a lot of data out there about formula and overfeeding and overdistending that stomach. That little tiny tummy in the beginning really gets the higher chances of obesity long term. Breastfeeding improves IQ, school attendance, and associated with a higher income in adult life, improving child development and reducing the health costs through breastfeeding, because your moms are giving them immune boosting properties that are now making it so the baby doesn't get sick as often, so they don't go to the doctor, they don't get ear infections, digestive issues, hospitalization nearly as much for breastfeeding mamas or babies as formula. So, importance of breastfeeding: few children receive nutritionally adequate and safe complementary foods, especially there's many countries where the fourth of the children ages 6 to 23 months of age, they need that appropriate feeding, and they're having challenges making that happen. 40% of the infants 0 to 6 months of age should be exclusively breastfed. So they're saying currently they are being breastfed 40%, but our goal will be internationally to have breastfeeding for all of our babies the first 6 months of life. Even a lot of families, especially in the United States, are introducing food, cereal earlier than 6 months, and that's just escalating that obesity pandemic occurring. Over 820,000 children's lives could be saved every year under the age of 5 if we were doing more breastfeeding. It breaks my heart when you have all these digestive issues, you have infection risks, that formula doesn't protect against those changes. By a baby breastfeeding on a mom's areola nipple, they are a symbiotic relationship. The baby is telling the mom, I got exposed to this germ, and the mom's breast will now make some milk for next time around to help and fight the infection the baby has been exposed to. Undernutrition is associated with 45% of the children deaths around the world. Organizational recommendations. The American Academy of Pediatrics recommends exclusive breastfeeding for 6 months of life, continuing to breastfeed as long as you both desire, even into the 3rd year of life longer. So the World Health Organization has really been pushing to reinforce a minimum of 2 years, There's so much benefits, even as the baby starts getting introduced to food at 9, 10 months to a year. There's still so much benefits to breastfeeding that baby, complementing the expansion of regular food into their diet. The World Health Organization recommends mothers worldwide exclusively breastfeed the first 6 months of life to help with growth, development, and the overall health of the baby. And so we talked briefly already, the complementary food, you're gradually introducing to the baby food. They're not eating what you're eating off the table at 6, 7, 8 months. I barely started introducing samples and just tasting of things at 9, 10 months. The first year of life, most of their intake should be breast milk. And then you're gradually introducing these things into their diet. Organizational recommendations. The WHO and the UNICEF recommend early initiation of breastfeeding the first hour. That's that golden hour. There's so much data about the success rates, the milk supply, the bonding, the postpartum hemorrhage risk for the mother, the endorphins. There's so many benefits to get going as soon as possible after the baby's born. I recommend just putting the baby skin to skin, and unless there's a true medical reason why the baby has to be separated from the mom, don't take the baby off the mom. Even if she's planning from the beginning, had good informed consent, and wants to bottle feed, there's a lot of great benefits for the mom and the baby's transition to still do skin to skin for that time. Exclusive breastfeeding for the 6 months of life. Introduction of nutritionally adequate and safe complementary foods gradually. So at 6 months, just a little bit of cereal, just a teaspoon here and there. It's a small portion. Help get the iron in their system, help get them a little bit of different flavors, but it's tiny amounts, and it's gradually introducing more and more that first year and a half of life. However, many infants and children do not receive optimal feeding. For example, only 36% of infants aged 0 to 6 months worldwide have been exclusively breastfed between the area of 2007 to 2014. So our goal would be 100% of babies breastfed at the first 6 months of life, but there's a lot of barriers present for that. Moms having to go back to work right away, family support, even just the knowledge deficit. If you don't have someone in your family that's breastfed and there's not good support systems close by to easily access, it's difficult to be successful at breastfeeding without that good support. History of breastfeeding. When historian Jacqueline H. Wolfe began researching the history of breastfeeding, the questions she found American women facing a century ago aren't so different than the ones today. Who gets to do it? How? What does everyone else think about it? So those are a lot of challenges. Even 100 years ago, we think, oh, times have changed. We're still having the same frustration and challenges we did. Until the last 120 years in the United States, if you didn't supply your baby with your own milk, the baby had a very, very high chance of dying. The history of formula was really out of necessity for these babies that couldn't have their mothers, and that's how it had started. Interestingly enough, the word formula stems from the 1890s, and it literally was taken from the mathematical formula. By making this product, it literally got its name formula from the direct derivative of it. Physicians were absolutely desperate to try to find a way to save babies' lives, the ones that couldn't breastfeed for one reason or another. They thought that they could humanize cow's milk, mimic the substances that they recognized from the human milk, so the percentage of the fat, the percentage of the proteins, and the milk sugars. We know now that the protein in cow's milk is completely different than the protein in human milk, but we're trying to do the best we can with what is available in mass production. Formula companies didn't tout themselves as being any way superior to mother's milk. It was made out of necessity to help save these babies that didn't have their mom's breast milk. Nowadays, it's completely different. The marketing of formula is more to brag how similar breast milk and formula are to each other, so it's really, quote unquote, a choice. It was around that time Nestle's food came on the market. Businesses of powdered milk formula really started getting promoted. In the past, it was just cow's milk and adding those supplements, and then being able to make dried milk allowed for the business to really take off. Easy transport, could be stored a lot longer, didn't require any mixing with the cow's milk, which made it spoil in urban areas. And then if there were no dairy farmers nearby, it made it a challenge to make the original versions of formula. Cow's milk at the time was a scandal, which is why infant feeding could be so deadly. Just reinforcing back 100 years ago, if you could not breastfeed or get a wet nurse for your baby, the chances of survival. I walk cemeteries often, and it just breaks my heart looking at the years of mom died, and then 3-4 months later the baby had died. It was very consistent themes. If the mom died during childbirth and didn't have another source of food for that baby, the baby didn't stand much of a chance. History of breastfeeding. The U.S. was rapidly urbanizing and industrializing it, and that changed everything for the American culture. When women were starting to go more and more to work, you needed an option to be able to feed the babies. And we see this introduction of an infant care model and very detailed feeding schedules. There was expectations of it wasn't feeding the baby as they requested it based on their feeding cues. It was trying to create structure and control, which is very similar to today's model. The baby should eat every 2 hours, this amount, this long, and very structured, which is not how formula, or I should say how breastfeeding is at all. The theory that an adult was having a hard time with scheduling, and if they could adopt a baby to schedule, they wouldn't have such a hard time. If the baby were put on a strict schedule, that would make the mom's milk supply go down. So it was this oxymoron of structure, control, and pediatric and care providers really trying to, quote unquote, help the women, but actually being counterproductive in the process. Women started to complain they didn't make enough milk. Does that sound familiar? And that's when medicalization of breastfeeding began, because doctors became involved to help fix the problem of lactation failure. I find that always so ironic, because our society had survived birthing our babies and feeding our babies for thousands and thousands of years, and then modern medicine gets involved, and now there's lactation failure, there's arrest of labor, there's a lot of outside paternalistic influence of our women's rights. No one connected it to the change in culture and the change in infant feeding habits. The doctors came up with all these theories. One of them was lactation was simply disappearing function. I find that really hard to believe that evolution had changed that quickly, but there was a large group of doctors who feared that the girls in school that were going through puberty, their reproductive systems were competing with their brain for energy. Wow. So having your school and your brain not be able to take care of, if we overeducate women, then now they can no longer birth and feed their babies. That's really hard for me to digest in today's day and age. Reasons breastfeeding was a hard topic to discuss, and it still is a hard topic to discuss. The big reason was any discussion of infant feeding has a lot of emotion, controversy. Women take it very personally when you talk about their birth and breastfeeding. If they didn't have the birth that they perceived they should have, if they didn't have success with breastfeeding and wanted it, women take it very personally towards how good of a mother they're going to be. So women who are mothers tend to be a big part of their identity. They want to perform well. They want what's best for their children. They feel very threatened when you criticize how their body could or could not do a certain function. Infant feeding absolutely is a woman's choice, and there are all kinds of reasons why women should feel what's best to feed their baby, but we want to make sure there's good informed consent, there's good support, there's options. I had a really high breastfeeding rate with my practice because breastfeeding was the normal, there was amazing support present, and women had what they needed to make it successful. There wasn't a lot of pressure of structure and weights and schedules and all these complicated positions that 20 people are telling them different perspectives on. It was simple, it was consistent, it was a phone call away for support, and those are vital, those first couple months of breastfeeding, because it is hard if you've never done it before. It is a learning curve, and you need certain things in place that sometimes our healthcare system isn't able to offer with how insurance reimbursement is set up. But you can't talk about breastfeeding in the United States without pointing out that every other wealthy country has found a way to accommodate breastfeeding mothers, usually in the form of a lengthy paid maternity leave. So we rarely have maternity leave that's paid by an employer. You usually have to save up yourself. There's many countries in Europe where the mom and the dad have 6, 8, even a year plus paid maternity leave so that the mom can get an amazing breastfeeding supply, she can support her family, she can recover appropriately. Our society, many families are financially forced to go back to work 2-3 weeks after they have a baby because they have to pay their bills, and they don't have that government or employer support of being able to stay with moms and the babies. So it is very, very difficult to support breastfeeding when you have to go back to work. You haven't gotten a good milk supply yet. Your baby is so brand new. There's a lot of changes happening in a short amount of time. It's very hard for American women to breastfeed, even with our own medical guidelines in place, because the social support isn't in place. We talk often about, federal rights allow women to breastfeed in public, but it's very difficult. It's uncomfortable. You're looked at funny. It's not truly supported. There's many news articles of people being kicked out of areas, being harassed for breastfeeding at their business or in a public place. So it's not truly supported on a national level that breastfeeding is best for our babies. So these are breastfeeding statistics, just showing you, and I was trying to clarify from this, I believe this is the first 6 months of life. So there are some country or states that are better than others, and you can see typically the further south states are a little bit harder. I wanted to find a lot of data of birth centers and midwives, if that had influenced a lot of the decision making, but it's pretty scattered all over the place. Some states are very very supportive of breastfeeding, and then the state right next to it is terrible. So like California and Oregon have 40% plus, but then Idaho right next door is less than 10%. So there's a lot with it. As far as statistics, among infants born in 2015 in the United States, 4 out of 5, approximately 83%, started to breastfeed. Women wanted to breastfeed, and every 12 hours, every 24 hours, especially in the hospital setting, the success rate drastically goes down. A good chunk of it has to do with the support in the hospital, the consistency of education. Lactation consultant comes in and says one thing, the pediatrician comes in and says something else. It makes it very hard for families to have confidence and feel like breastfeeding is more complicated than it really is. Over half, 57%, were breastfed at 6 months. 1/3 were breastfed at 12 months. It didn't go into details of exclusive, fed from the breast directly, or fed breast milk. These are compared to rates born in 2014. The rates of the babies born in 2015 did increase from 6 months to 12 months. So that's a great sign that our families are gradually starting to do extended breastfeeding. But when our goals are to breastfeed for 2 to 3 years, we still have a long ways to go. The breastfeeding rate higher, get it longer. So these are the Healthy People 2020 World Health Organization objectives. Some of them we're going to meet, some of them we're not. Increasing the proportion of babies ever being breastfed. Increase the proportion of infants exclusively breastfeeding at 6 months of life. Increase the proportion of breastfed at 1 year. So we are meeting the trends. I mean, it's interesting to say a target is 34%. I would love to see 100%, just those few little percentages off for medical reasons. Like, those would be my personal goals. And I made it very possible with my own private practice. Increasing the proportion of breastfeeding exclusively. See the big difference of babies that were breastfed at 6 months versus exclusively. It should be the same. There's some miseducation to families that they're introducing formula, they're introducing cereal, they're introducing food too early for these babies. And there's a lot of link with allergies, asthma, immune compromising disorders, lifelong obesity from introducing regular food too soon and giving increased proportions to what the babies truly need. Giving access to women to have lactation programs, support, on-site, easy accessing breastfeeding rooms are really essential to pump and to be able to continue to breastfeed when they're separated from their babies. Reducing the proportion of feeding newborns on supplement the first 2 days. It should be rare that formula is offered, especially when donor milk is easily accessible by many hospitals now. Formula should be really a last resort of an option. Increase the proportion of live births that occur in a facility that provide lactation support, recommended standards consistently. Baby Friendly Initiative is doing a really good job around the world to help get hospitals on the same page so that moms have a better chance with breastfeeding success. Benefits of breastfeeding. Babies, we've reinforced this over and over again, giving your baby all the nutrition, the growth factors. The mom's body knows exactly what this baby needs. A 1-month-old baby is going to have consistently different food, milk composition as a 6-month-old baby, a 1-year-old, a 2-year-old. Every developmental milestone, that milk is constantly changing. The fat content, the high milk, the foremilk, everything is changing for the nutritional needs of that baby based on that symbiotic relationship. It helps prevent infection, boost immune system, protect against obesity. It's very comforting. It's a strong bonding mechanism. Breasts are not just a feeding source. They are a pacifier. They are comfort. If the baby gets hurt, it's a very soothing process. It's easily digested. You have a lot less GI infections, which are a lot of why babies are hospitalized and die for those first couple of years of life. For mothers, it lowers the risk of breast and ovarian cancer, diabetes, osteoporosis, rheumatoid arthritis, and depression. The return to pre-pregnancy weight happens more quickly. The metabolism is actually faster with breastfeeding than it is during pregnancy. It's estimated that 300 calories extra a day are needed for pregnancy, but for breastfeeding, it's about 500 extra calories. So your metabolism is actually faster, and the longer you can do the breastfeeding for, it'll help to keep your body in that faster metabolic state. Reducing postpartum bleeding has to do with the oxytocin surge. That nipple stimulation gets that uterus to contract down firmer and faster. So the bleeding is a lot less those first couple weeks. The mom's energy level gets a lot better when she doesn't have to replace that blood supply. There's a lot of great benefits to moms and babies for breastfeeding. We talked already, it gives your baby comfort and nutrition. It is used to keep them close to their mothers as a comfort. It helps keep the mom and the babies relaxed. It helps with postpartum depression. It decreases stress hormones for the mother and the baby. So especially that golden hour when the baby is transitioning just came out, the heart circulatory system is changing, the respiratory system is completely changing. Being able to be close to the one thing the baby really knows is vital. Sticking a baby in a warmer when there's no medical indication, it just causes extra stress and trauma for the mother and the baby. So milk gives the baby everything they need at every stage of life. It changes. I reinforce this over and over again. The breast milk is constantly changing for that baby's needs. Formula comes from a cow or a soybean source. It's harder for the baby to digest, leading to allergies, diabetes, infection, and intestinal bleeding. Your breast milk has proteins that fight infection and viruses that formula will never ever be able to replicate. There's no protective, like when you read the recommendations for formula, it says as soon as you mix the bottle, you should immediately be giving it to the baby because of the higher chances of bacteria growing in that formula. Breast milk, as soon as it's pumped out of a mother, it can sit up to 24 hours and still be given to the baby later because of all the antimicrobial, the bacteria fighting properties of breast milk. So there's night and day property differences just in the basic recommendations. Cost difference, like my husband made me laugh the other day. He was just going down the aisles and he's like, how can anybody afford $40 for a can of formula? We've been so blessed to be able to breastfeed our babies, and we never had to deal with that extra cost that's involved for formula fed babies. Wouldn't you rather have that $40 for formula you can use for something else? Your body can make a free, perfect food source for the baby. So we really need to stress how valuable this is. It can save babies, it can save moms, it makes them smarter, it makes moms' outcomes better, it's cost saving. If I'm grateful we have formula for those medical indications, but that's after donor milk, that's after trying everything we can to breastfeed that baby if a mother chooses. So over and over again, all the benefits to breastfeeding, and you can use all these resources and pictures to help with your education to moms and families. But it's just reinforcing again, breastfed babies, breast milk is better if they can do it. They sleep better, they saving money, the weight loss, the benefits for mom and baby, it just goes on and on and on. So we talk specifically about the hormones, the enzymes, the things, even for premature babies are finding more and more data how important breast milk is in mom, either doing expressed milk or donor milk for their babies during those premature stages. The fat content is really important for brain development and increasing the IQ. Saves time and money. We talked about it briefly. Estimated $1,700 a year. $1,700 is a lot of money if you think about all the things you could do, let alone the supplies, the nipples, the bottles, the cleaning supplies. It takes time to prep and prepare. Versus your breast milk is always the right temperature. It's always easy accessible. You don't have to prep and plan to take all the food source with your baby. Even just not just the cost of the formula itself, but the cost of doctor's visits for your baby getting sick, hospitalization, medications, testing. Intervention does lead to intervention. The time to stay home with a sick child has a cost to it. It's involved in all that numbers. Stages of breast milk. Their baby's tummy is super, super tiny in the beginning. I always like to talk to my families the first few days. This baby's tummy is the size of a marble. They don't need much. The colostrum that a mother's body makes those first few days of life is very high concentrated fats and proteins. And it's like the sticky sugar that's very hard sometimes to even see the amount. And moms get confused and worried they're not making enough. So it's constant reassurance and constant confidence that this is what your baby needs exactly at this point in time. The milk supply between day 3 to 5 will really start coming into that third stage, which is what the moms are going to make for the baby long term. The first stage of milk is as soon as you get pregnant, that breast tenderness is your breast actually prepping for the baby. So during pregnancy is the first stage of milk. The second stage of milk is once the placenta detaches and the baby is out. That's the colostrum. And then the third stage is when you have your full milk production coming in around day 3 to 5. Babies are born with extra fluid stores. They're meant to have a little bit of weight loss the first few days of life. There's a lot of controversies with the growth curves of the pediatric organizations of the United States versus the World Health Organizations. So the pediatric organization, their growth curve is based on studies of formula-fed babies. The World Health Organization's growth curve is more on breastfed babies because they do have a very different growth curve. Colostrum, we talked about it already. It's what's very protective and specific the first few days of life, and we don't want to overfill the baby's tummies. We don't want to have spit up, and they should be eating small amounts all the time. Like I joked, but I didn't joke with my mamas. You should feel like you're nursing all the time the first couple weeks of life. Skin to skin nursing, get a good milk supply. Your baby is learning how to nurse. Your body is learning how to make the milk this baby needs. So just snuggle in bed, have people take care of you. Focus on taking care of your baby, and your milk supply will be a lot better. So these are the great comparisons. Please take this this picture to show families this is all babies need. It breaks my heart when I see formula right from the beginning, 30-40 ounces. These babies are just, their tummies are getting over distended so quickly at the beginning, and then families will brag. It's like this mothership owner. It's how good of a mother you are while your baby is sleeping at nighttime. Well, if you're stuffing tons and tons of food that's hard to digest, it's sitting there, it's overstending the tummy, yeah, they're going to sleep 6-8 hours, and it's not because of what's best for them. So we really have to change this shift to our moms of how good of a mother you are, how good the baby is sleeping at night, how often the baby is eating. Formula-fed babies are completely different than breastfed babies as far as their frequency of eating, the needs that they have, their demands. It's scheduled, it's structured right from the beginning, and moms have a harder time grasping. They want to know how much their babies are eating. They want to give reassurance that they're getting enough in their tummy. So with breastfed babies, I always reinforced your body knew how to grow this baby. Your body will know how to feed this baby. The milk will constantly change. The baby's arms, your baby talks to you even though they don't have words. They have feeder meters. I talk about their hands. The more tight their hands are while they're nursing, the hungrier they are, versus that they start to relax. They start to become like jello, that really euphoric state after they're done feeding. That's how you know the baby is full. The baby will self-detach. It may take longer in the beginning, like you're going to nurse every hour and a half for maybe up to 45 minutes, and that's okay. As the baby makes the milk supply, gets better at transferring it, by the first couple months, it should be a little more structured. It should be about every 10 minutes for every couple hours, but the baby will go through growth spurts. The baby may not feel good. There's different variations of normal. So these are those two growth curves that I was talking about. There's growth curves for boys and girls. This one is specifically the World Health Organization. I didn't want to give an example of the AAP, the Pediatrics Association, but it's reinforcing this growth curve. Let's see. So they do actually put on here the CDC, which is the one that pediatrics use. So I wanted to reinforce, like, this is the option of the curve is different for breastfed babies as it is for bottle-fed babies, and too many mothers are felt pressure. They're not making enough supply, even though what the curve of their baby is normal. The chart that the pediatrician may be using has the pressure that your baby's not growing fast enough because they're being compared to a formula-fed baby. Stages of milk, we already talked briefly about that. There's 3 distinct stages. The baby is given colostrum those first few days, then it's switched over to more of a transitional milk before the full milk comes in, and that lasts the first couple weeks. and then the content gradually shifts over to high levels of fat, more water-soluble vitamins. Contains more calories in the colostrum. Colostrum, it has a very specific purpose. It's stickier, it's yellow, it's thicker. It's just really high fat, protein, minerals, and immune boosting agents. Mature milk, the final stage that's being produced, 90% of it's water, which is necessary to keep the baby hydrated. You shouldn't be giving your baby juice. You shouldn't be giving your baby water bottles. Your milk is giving your baby everything it needs. So there's two types of mature milk. There's the foremilk, the hindmilk. The foremilk is what comes out at the beginning. Especially if you're pumping, you can see the differences. When you're breastfeeding directly, you can't see that transition. And that's why I stress not to do structured schedules and timing with babies, because moms will separate the baby from the breast much sooner than that hind milk has really gotten a chance to be in the baby's body. So you can be having overabundancy issues, lots and lots of milk, but it may be the baby's getting so full of water that hind milk is really important for those babies to get the fats and the an essential weight gain. So that's why I stress pumping is okay if you have to go back to work. Just don't pump too much, because if you're telling your body you're making twins but there's only one baby, that baby's going to have some trouble, because now most of the milk the baby is getting is so focused on the foremilk side versus hind milk. So if the moms can, the first month of life, I really stress, do not pump unless you have to. Let your baby nurse from your breast, make your milk supply based on the baby's needs. Continue to take your prenatal vitamins just like in breastfeeding, because it's a high metabolic demand. The nutrition that you are making, I always joke with moms when they get worried during pregnancy and their babies, like, how do I know my baby's okay if I got the cold? Moms are second rate to these pregnancies and these breastfeeding. We get the leftover nutrition. So prenatal vitamins are more for the mothers than they are for the baby for pregnancy or breastfeeding. We get the leftover nutrition that the baby allows us to have. Getting baby into a right position. There's a lot of positions out there. There's a lot of information to help women, because a good chunk of the frustration is the nipple pain, the cultural misunderstandings that pain is normal and you should be having pain or otherwise you're not doing it right. And it's the complete opposite. If you're hurting, there's something going on. It's the angle, it's the tongue tie, it's the latch position, it's how much the baby does not nipple feed, they breastfeed. And I stress that over and over again to families. You want to get as much of the areola in the baby's mouth as possible. The baby gets a good and strong suck reflex once the top and the back of the roof of the mouth is being stimulated. When you put your finger in the baby's mouth, as soon as you touch the gums, the teeth at the beginning, the baby's not going to suck. The baby's not going to suck on your finger until it goes farther to the back of the roof of the mouth. And so you want to get as much of that breast tissue. So making a hamburger in a big open mouth, so you can't force the baby to open. You have to do skin to skin. You have to wait till the baby is ready to nurse. We can't force them to nurse, and we can't tell them when they're done. We have to follow the feeding cues of your baby. Making sure that the baby is facing you. I always give the example, if you tried to eat sideways or drink from a straw sideways and your neck is cockeyed, it's really difficult to do and it's hard. So we want to be straight. We want to mimic with the baby like if we were eating food. So having a pillow, having comfortable positions. I'll talk more. My favorite position is the laid back nursing, and you'll find out why in a little bit. There's different breastfeeding positions. The cradle is the one most people are familiar with. It's a position where the baby's head rests on the elbow of the mom's arm, and then the other hand will support the rest of the baby's body. You cup your breast with your other hand, placing the thumb. You want to make like a squish sandwich for the baby to open. So I tease the top of the baby's mouth with the nipple, and then when the baby does that big open mouth, you do a down inward angle. You want those lower and lip and the upper lip to be curled out when the baby is on the breast, and as much of the breast in the baby's mouth as possible. So here's an example of the crossover hold, and this is where you're holding the baby I like this one better than the prior position, and this one is not as good of an example. The mom should have her hand over the baby's neck, not so much directly the head, because you want to be able to have the baby have control. If we're pushing the baby's head in, we're going to change the angle. The babies are strong. We want to just support their neck so they have control of their head and they can turn to get the right angle, maybe pull back a little bit to get the letdown to happen a little faster. Give our babies more control. This one would kill a mom's back in time. It's awkward. The baby's, she's not sitting well. This would get very tiring soon, especially as the baby got older. So we'll talk why the laid back breastfeeding is so perfect. It's my favorite. So this is a football hold. It's great for C-section mamas. This is an older baby doing it, but it's the point. You can do it any angle you would like. My kiddos, as they got older, wanted to be more upright versus flat. So this is a great one with twins, for little tiny babies, women with really large breasts that make it harder to do the cradle and the cross cradle, just because there's a lot to hold on to. And so this one, she's doing a little better of supporting the neck than the prior picture. And it's just putting a good pillow, getting a good position. She's got a good chair to sit in. It looks like a rocking chair. So find a position where you can relax. That'll help with the letdown. The more tense and all your muscles are tight and anxiety present will make it harder for that milk supply to come down from your breast, especially if you're hurting and you're really nervous about it being successful. Time, but it will happen. We have to be patient with these babies, but they will root and they will crawl, and they will go right up their mom to find the breasts. There's a reason the color changes for the nipples a little bit darker. Babies can see those colors and contours. They can smell the colostrum. This one is great long term. You can lay in any position. The mom's nice and relaxed, put the baby skin to skin, and the baby will just root right over and go to its mom, and the baby will be nice and ready. I always like to give the example, if you want the baby to nurse, you put the breast in their face and they're not hungry, you're not going to be able to force it. How would you like it if all of a sudden somebody blindfolded you, stuck you in front of a table, a buffet, and started shoving food in your face? Would you be a big fan of it? So give them an opportunity by being skin to skin, relaxed, laid back. Give the baby an opportunity to realize, oh, it's feeding time. There's that milk. I'm going to go find it. Then they can eat at their own pace. So sidelining nursing is a little more advanced. I've seen a few first-time mamas can do it right away, but it takes a little more skill. It's a great co-sleeping, more relaxed position depending on the size of your breast and how old the baby is. I find this one really nice as the baby is older, and it's a nice napping, snuggling if we're both going to go doze for a while position. And so we'll just fall asleep being close to each other, and you don't have to move the baby off your chest or anything. Signs your baby is hungry. These are really important things, the feeding cues. Just like, even though the baby doesn't have words, the baby talks to us. The baby tells us when it's hungry and when it's full. The baby will start rooting, which is turning its head to the side, looking for the breast. Especially if you tease with your fingers, the reflexes on their cheeks, they'll start trying to reach towards that finger you're teasing with. They'll start trying to put their hands in their mouth, especially when they get a little bit older, because they're looking for food. They're turning their head side to side. They're more alert. They're more agitated. They're a little more tense. The muscles are tense. If they're crying, we've been waiting too long. We've missed those little hints the baby is giving us. They're sucking on their hand, opening and closing their mouth. I really reinforce crying is not a way to open up their lungs after they're born. Crying is not normal. Babies that are breastfed and listen to the early cues rarely cry. Crying is a form of communication once we aren't listening to their other forms of ways the baby is talking to us. And you'll find out that some babies will learn, okay, my mom and dad didn't understand I was hungry, so I'm just going to skip those little early cues and I'm just going to go straight to crying because that's how I got my attention. Hunger cues are easily seen before the baby starts crying, but you have to know what to look for. So teaching families what are the early signs of hunger cues, that's why I always like to say the feeder meters of the arms. The more tense the arms are, the hungrier the baby is. When you're nursing, the more relaxed the arms get, the fuller their belly is getting. Once the baby cries, it's also harder to latch them. So we want to catch them in those early signs of hunger cues to get a better successful latch. The last thing we want from a mama is a crying, stressed out baby that's over hungry, and now she's trying to nurse that baby and get a good latch, get her letdown to happen. It just makes it a really tough situation. Signs that your baby's belly is full. The baby will self-release. We do not need to detach the baby from the breast. The baby will actually turn away from the nipple, especially as they get older. You can't force a baby to eat. I remember with my engorgement, I'd be like, please, baby, eat. I'm so full right now. And if the baby's not hungry, they're not going to eat. Their hands are going to relax. Their body's going to relax. I joked it was called the milk coma, that the baby just becomes this big flaccid jello when they get a nice full belly from mama. And so the ins and outs, so what goes in must come out, the changing of the diapers, how wet they are, how many pees and poops you're getting really will show. And you don't need much in the beginning. The first 24 hours, the baby should have 1 pee and 1 poop, and that's all they need to have out. And then day 2 is 2 of each, day 3 is 3. Then once your milk supply comes in, the wet diapers will drastically increase. It's harder with diapers versus the cloth because they absorb so well. Sometimes it's tough to tell, okay, is there a wet in that diaper? Many of the diapers now have that blue indicator at the bottom so you can tell if it's wet, but it's one of those things based on if your baby is hungry. Even if you aren't giving enough to that baby will nurse and nurse and not want to get off because its tummy isn't getting full and satisfied. So I talk over and over again, the hands are feeder meters. The more tense and against the breast when you're nursing, the hungrier the baby is. And as the baby starts getting that milk transferred, like if the arms are kind of halfway up and a little bit more tense, then they're halfway full. And by the end, when they self-detach, they're going to be really relaxed and not want to nurse anymore and happy and content. The breast milk should be the only source of food for a baby the first 6 months of life. They don't need cereal, they don't need water, they don't need juice. They just need their moms and their breast milk. Especially in hot water or hot weather, people have the misunderstanding that you have to extra hydrate them. The babies are just going to nurse more because most of the breast milk is water content. So it is better to be giving them exactly what they need from your body. Early months of the baby's life are essential for long-term development. Breastfeeding gives your baby the body-building components that are particularly suited to his health or development. Milk from an animal or plant source does not contain the same things that human milk from their mothers directly has for those babies. First 6 months of life is best for the baby's health to be giving mother's milk. The baby's body stores of iron slowly deplete that were given to them from your pregnancy. So that's why the recommendations are to start cereal at 6 months of life. Not that they need the nutrition, but the iron supplementation from it. And you can always just get an iron supplement to start at 6 months of life. Your breast milk makes all the proteins and all the things that the baby would need. Given the baby other foods or liquids that have iron, it's another option so they don't get a little anemic. Babies that are breastfed have a lot less illnesses and less pneumonia, respiratory infections, especially the ear infections, the intestinal diseases, the allergies. There's just so many benefits to breastfeeding. Not ready to take other food until 6 months of age. There's so many misunderstandings. The intestinal system is not meant to have anything besides breast milk before first 6 months of life. There's very small pores. They're like little nets. If you give them a baby anything besides non-human proteins, they will go through those pores and go into the baby's body and make allergies because they're not ready to be having those foods yet. At 6 months of life, they're able to sit up more, their choke and gag reflex. There's a lot of developmental things needed for babies to have other food besides their mother's breast. At around 6 months of life, the baby's tongue can move into an acceptable position to get the food. Other than breastfeeding, they push the tongue out. So there's little things, the cavity of the mouth deepens, the baby is able to have a spoon a little bit easier. There's special proteins in the breast milk to help fight off infection. So you want to give, I'm just saying it over and over again, breast milk at the beginning, exclusive breastfeeding the first 6 months, gradually, slowly introducing food. They don't need much in. So the first year of life, you can give them introductions, little taste here and there, little spoonfuls, but their tummies are tiny and their proportions of breast milk to bottle needs to be taken into consideration. They have problems with oxygen levels and developmental disease if we try to push the foods quicker than their body is ready for. So after the first year of life, you can start adding, and we talked over and over again, I didn't do much. Like an ice cube tray was what I used. I made a little tiny ice cube, and that was a serving for the baby just to do a few tastes. They don't need much. There's very specific facts. I feel like I'm just reinforcing over and over again, but there's short-term and long-term benefits of breastfeeding 2-3 years for the baby, not just our statistics, especially in the United States, drastically go down that first year of life. If we can support our mothers and our babies and allow breastfeeding until this child is a toddler, it will just help everybody. Breastfeeding is a comfort, it's an emotional support, it helps with their IQ, it helps to be more confident and secure that their mom is there for them. People think, well, the kid is going to be needy and clingy, and that's a giant myth. If you actually look at the evidence, the babies that are breastfed longer are more confident, they're more secure. They know that their needs are going to be met by their support system, so they're actually a lot less separation anxiety. They are confident that their mom and their parents will be there for them. As the baby is in contact with other children, daycare, playing with cousins, there's going to be more infections that they'll be exposed to. And that symbiotic relationship of breastfeeding will tell, there's a reason they put dirt in their mouth and now they're exposed to a bacteria, and then they breastfeed, and then that tells the mother's body to make things to fight that infection. So you can definitely tandem nurse. Tandem nursing is when you breastfeed your brand new baby and your toddler at the same time. There's not a lot of evidence and studies of which baby trumps, from my assumption, because the placenta just got detached, that it's going to revert back to more of a newborn breast milk that the toddler is going to be getting, but there's no hard data to show the composition. If you have two babies nursing at the breast, what kind of milk is being made for those babies? Low long-term breastfeeding rates. I would love, love, love to see not just increased numbers of breastfeeding rates, but long-term breastfeeding rates be improved. High breastfeeding initiation rates show that mothers want to breastfeed, and we need to support them doing that. Despite the recommendations to exclusively breastfeed the first 6 months of life, we have less than half mamas doing it for their babies. It's very difficult in today's society. The consistent education, the long-term maternity leave not being available, the pressures of being a mom in today's society, and our media and our social support. It is encouraged, but it's not encouraged. It's just this subliminal messaging that, oh, it's okay. Why? Oh, you're one of those hippie mamas. Like, when should be given to all babies. So really reinforcing the education and shifting our cultural norm. The rates of low breastfeeding, I just keep reinforcing, it has a lot of complications to the mom and the baby, hospitalization, infections, bonding. All these needs that are present are very, very difficult to be successful when we're not continuing breastfeeding. There's different ways to improve success rates. Early postpartum period is critical for establishing and supporting breastfeeding, the golden hour. And I want to argue that prenatally, as soon as they have their first visit. How does your office support breastfeeding? What little subliminal messages do you send, even if you're not saying anything? Do you have Enfamil branded products in your office? Do you have women breastfeeding in your waiting area? What message are you sending to women prenatally to say breastfeeding is truly best? And then labor and delivery, home birth, birth centers, those first few hours after the baby is born really has a difference in setting up the success rate. I can go into details of inductions and medical interventions and IV fluids. Intervention leads to intervention. It truly does. If you have a 3-day induction with oxytocin and lots of fluid, that increased fluid influx to the moms really makes it hard to get a good long-term milk supply. Postpartum hemorrhages make it hard to get a good long milk supply. Dehydration, stress, poor sleep, all those things inhibit a good milk supply that's common in our everyday American birth setting. Recognizing this, one of the Healthy People 2020 objectives is to increase the proportion of live births that occur in facilities that provide the recommended care for lactation. So that has to do with the baby-friendly initiatives. There's 12 states, there's over 40% of all births occur in baby-friendly facilities. And I know hospitals across the country are working towards getting baby-friendly initiatives. And it's getting everybody on the same page, staff, same education, prenatal visits education, in the office, the consistent message that breastfeeding is best. Over 1 million babies are now being born at baby-friendly facilities, and the Healthy People 2020 objectives we talked about early are being met, but I think the bar needs to be set higher. I think we need to we're going the right direction, but we need to make a massive shift of what is truly best for moms and babies and how do we support them through it. Ways to improve the success rate, we talked over and over again. Critical is the mom's returning to work. The sooner she has to return to work is a direct correlation with how long she'll be able to successfully breastfeed her baby. So if we can get governmental programs that are more like Europe, where we can have mom and dad a year and a half off with their babies and paid so they're not stressing about the bills, would be amazing to see. Almost half of the employers provide separate on-site lactation rooms and breaks that allow her to pump. I really wish it was 100%. We've got a long ways to go. 5 out of the 8 Healthy People initiatives objectives have not been met with our nation. So we have a ways to go with even just getting some of those smaller bars set. All sectors of society, not just the healthcare system, the providers, the nurses, our neighbors, our sisters, our aunts, our mothers, we all need to support breastfeeding. The dads, the grandpas, the brothers, like the children, like we want our next generation of kids to see that breastfeeding is normal. It's done in public. It's not hidden. There's discussions with children that formula isn't the norm. What the mother's body makes is normal, just like a cow makes for their babies and every other mammal. So we really have to enforce education, shifting cultures, getting back to the basics of confidence that a mother's body can grow a baby, birth a baby, and feed their babies. Families need to be supported by their community, and these are some great resources about that. You can look up the International Code of Marketing. There's just so much with the legal rights of breastfeeding in public. There's a lot of court cases with it. There's just so much pushing, supporting mothers prenatally, helping to get the baby nursing right away, extended maternity leave, stressing the benefits short-term, long-term of breastfeeding for the first 2 to 3 years of life, not just the first few months. So implementing the 10 steps for baby friendly is really vital. Skin to skin right after baby is born, nursing that first hour, breastfeeding on demand, not putting a time structure to when the baby wants to eat, reinforcing it's normal, not that you're not making enough milk for the baby, that they get tiny concentrated amounts. They need their mothers. They need that constant suckling to improve the long-term supply and get that easily digested milk into their system. Rooming in, allowing the baby to be close to the mother, easy. Mom can read the hunger cues. Sending a baby to a nursery really decreases the breastfeeding success rate, short-term and long-term. Not giving the babies additional food, water, unless medically necessary. If the blood sugar is low and you've already nursed and can't get it back up, that's one thing. But too many times formula is like, oh, we act like we want to be helpful to moms. You look really tired. Let me give the baby the bottle this one time. By doing that offer, we're really making her supply lower, her stress level higher. We're not helping out the mom long term. So we need to support breastfeeding and support getting a good latch, support laid back breastfeeding, supporting when the baby is sleeping, that mother is getting taken care of and also sleeping. There's provisions with the governmental healthcare system. We as a society need to be there for moms and babies throughout the life, really talking about the feeding options, the association with the sick visits, every encounter that a healthcare provider has with that mother prenatally, right after birth, those first few years, reinforcing the importance of breastfeeding. Community support. WIC has some great programs. La Leche League has great support programs. A lot of the hospital systems have great support groups. Getting moms connected with moms so that they can learn from each other versus they're always learning from the healthcare system. Breastfeeding practices are highly responsive to supportive interventions. It's not medically managing. Midwives and birth workers have to support women and give them empowerment and encouragement that their body knows what to do. We can help them with little tips that may or may not work for them. It's individualized care. It's individualized needs for each mother and here's some great resources and references if you need to look things up, but it takes time, but change is upon us. Women have knowledge at their fingertips, and we want to be able to support them to make the best decision and be proactive. Look at the barriers that are present in today's fast society. Financial constraints. How can we support moms and babies on a governmental level, on a personal level, to make these changes happen? I'm Leslie Cornwell, and I look forward to seeing you at more educational videos.